uncovering the truth why healthcare costs are soaring. In a shocking revelation, the exorbitant healthcare costs in the United States are not just a result of high demand or advanced medical technology. Instead, they are a direct consequence of a deeply entrenched system of cronyism and tax loopholes, as highlighted by Newsweek columnist Peter Roff in his recent discussion with Gerry Rogers. Roff boldly asserts that the real culprits behind the ballooning healthcare expenses are the massive, tax-exempt hospital monopolies that are manipulating the nonprofit system to their advantage. These billion-dollar hospital chains, he argues, are abusing their nonprofit status to lobby the government for special favors, all the while shifting the burden of costs onto the shoulders of ordinary Americans. And here's the kicker. They are failing miserably in their supposed mission to provide genuine charity care. This episode delves into the murky waters of healthcare economics, tax reform, and the pressing need for transparency and accountability in the sector. But here's where it gets controversial. Roth's claims have sparked a heated debate about the role of nonprofits in healthcare and whether they should be held to the same standards as for-profit entities. And this is the part most people miss. The episode not only exposes the hidden dynamics of healthcare costs, but also challenges the audience to question the very foundations of the nonprofit system. So, what do you think? Should tax-exempt hospital monopolies be allowed to continue their practices, or is it time for a radical overhaul of the healthcare system? Share your thoughts in the comments below. Fixing America's broken healthcare system, the Marshall-Hickenlooper bill explained. Imagine being one of the millions of Americans drowning in medical debt, unsure of how much your next doctor's visit might cost, or whether you can even afford it. This is the reality for roughly 100 million people in the United States who are burdened by healthcare expenses, while another 25% of insured families avoid seeking necessary medical care each year simply because they don't know what the final bill will be. It's a crisis that touches nearly every household and highlights just how broken the American healthcare system has become. But here's where it gets controversial. What if the solution isn't more government intervention, but rather empowering patients with something as simple and fundamental as upfront pricing? Enter the Patients Deserve Price Tags Act, a bipartisan effort recently introduced by Senators Roger Marshall, R. Can, and John Hickenlooper, D. Collo. This legislation aims to tackle runaway healthcare costs head-on by giving both employers and patients access to clear, actual prices, not vague estimates, before any treatment is provided. Think about it. How many industries allow businesses or consumers to make decisions without knowing the cost beforehand? Yet, when it comes to healthcare, most Americans are essentially forced to write blank checks, trusting hospitals and insurers to charge them fairly after the fact. Spoiler alert, they often don't. Since the early 2000s, hospital prices have skyrocketed by an astonishing 257%, far outpacing wage growth. In fact, over the past 2 decades, increases in health insurance premiums have outstripped workers' earnings at a ratio of almost 3-to-1. For families already struggling to make ends meet, this trend is unsustainable. The Marshall-Hickenlooper bill seeks to reverse this imbalance by requiring transparency across the entire healthcare system. Under the proposed law, hospitals and insurers would need to disclose real prices, including negotiated rates and discounted cash payments, upfront. Additionally, patients would receive an advanced explanation of benefits, a detailed breakdown of their out-of-pocket costs, before receiving care. This shift could transform how healthcare decisions are made, allowing individuals to shop around for affordable options instead of blindly accepting whatever charges come their way. I recently joined a coalition of 40 leading health economists in signing a letter urging senators to co-sponsor and swiftly pass this critical piece of legislation. Why? Because economists understand better than anyone that functioning markets rely on accurate information. Without transparent pricing, consumers lack the ability to compare costs and providers retain outsized power to set exorbitant fees. Consider this. Research I conducted for Rice University's Baker Center uncovered staggering inconsistencies in outpatient hospital pricing within Houston alone. Prices for identical procedures varied by nearly 200% among patients covered by the same insurer. And it doesn't stop there. A separate study published in Health Affairs Scholar revealed that colonoscopy rates could differ by up to 7 times for individuals with identical coverage. These disparities aren't just frustrating. They're symptomatic of a deeply flawed market structure. Price transparency does more than level the playing field. It fosters competition, drives down costs, and redirects excess profits back into the hands of patients, businesses, schools, and workers. Imagine freeing up billions of dollars currently trapped in inflated healthcare bills and channeling those funds back into the broader economy. The potential economic stimulus is enormous. Employers in particular stand to gain significantly. Today, the average employer-sponsored family health insurance plan costs $24,000 annually, with employees shouldering the bulk of that expense through reduced wages and higher premiums. One analysis found that since 2000, nearly all gains in employee compensation have gone toward covering rising healthcare costs instead of boosting take-home pay. By providing employers with access to claims data and revealing the inner workings of health plan administrators, the Patients Deserve Price Tags Act equips businesses to root out overbilling and unfair practices. My research suggests that reducing annual premiums by just $1,373 per employee could increase retail business profitability by an average of 12.4%. That's a game changer for small businesses operating on razor-thin margins. Of course, you don't need a PhD in economics to grasp why upfront pricing matters. It's common sense. Knowing the cost of care beforehand allows patients to avoid overcharges and find affordable options. However, economists can shed light on the broader implications. Transparent pricing boosts business earnings, puts more money in workers' pockets, and stimulates overall economic growth. By mandating actual prices, as outlined in the Marshall-Hickenlooper bill, we can restore affordability, accountability, and trust to our healthcare system. And this is the part most people miss. Achieving these goals transcends political divides. Whether you lean left, right, or somewhere in between, everyone benefits from a fairer, more transparent healthcare marketplace. So, what do you think? Is price transparency the key to fixing America's healthcare woes? Or does the issue run deeper than that? Share your thoughts in the comments below. I'd love to hear your perspective. Revolutionizing healthcare, the case for site-neutral payments. Imagine the shock of receiving a hospital bill that leaves you questioning how you'll manage your family's finances. For millions of Americans, this is a harsh reality, with 67% of the country viewing healthcare affordability as a very big problem, according to a recent Pew Research poll. The financial strain is undeniable, and it's time for bold action. Last week, the Centers for Medicare and Medicaid Services took a significant step by proposing a new rule for site neutrality on drug administration. This move aims to lower healthcare costs for Medicare patients and signals a shift in how hospitals operate, aligning with the current administration's agenda. But here's where it gets controversial. While this is a positive step, it might not be enough. Now is the time for Congress and the administration to be even bolder. A comprehensive site-neutral payment policy, backed by bipartisan support in Congress, could be the catalyst for real reform and savings. At its core, site-neutral payment means that Medicare pays the same amount for the same service, whether it's performed in a hospital outpatient department or a doctor's office. This might seem obvious, but under the current system, Medicare reimburses hospitals at significantly higher rates for routine services like lab tests, imaging, and checkups. These price differences have nothing to do with quality or complexity. They are the product of a billing system riddled with distortions and loopholes. This unequal payment system is fueling a dangerous trend of consolidation in the healthcare industry. Hospitals have strong financial incentives to acquire independent physician practices, convert them into hospital outpatient departments, and charge higher facility fees for the same services. A new National Bureau of Economic Research study found that the share of physician practices acquired by hospitals rose by 72% between 2008 and 2016. The study also found that physician prices rose by an average of 15% within 2 years of a hospital acquiring the practice. These acquisitions reduce competition and inflate costs for taxpayers, employers, and most importantly, patients. We are witnessing a rigged system where big hospital systems exploit government payment rules to squash competition, corner markets, and pad their bottom lines. There are also hard fiscal realities at play. Medicare is projected to become insolvent within the next decade, and we must find smart ways to control spending without cutting benefits or raising taxes. Site-neutral payment reform is one such solution. The Congressional Budget Office has estimated that eliminating certain payment disparities could save billions over 10 years. These are real, structural savings, achieved not by denying care, but by refusing to pay more for the same thing. That's good governance. And it's a win for patients and taxpayers alike. Some opponents, particularly the well-funded hospital lobby, claim that site-neutral payments would harm rural hospitals. But that argument is misleading. The reforms under consideration target only routine services that can be safely and effectively delivered in non-hospital settings. Emergency care and complex procedures that require hospital infrastructure are not affected. While these sorts of scare tactics are to be expected, we can no longer allow massive hospital systems in urban and suburban areas to continue hiding behind the rural label as a shield for profiteering. The current administration and Congress have the opportunity to lead on a healthcare issue that reduces spending, restores competition, and protects patients from surprise bills. Embracing site-neutral payment reform is not only consistent with the promises elected officials have made to the American people, it is essential to preserving the integrity and sustainability of Medicare. Both should seize this moment to champion a policy that puts patients before profit and taxpayers before entrenched interests. And this is the part most people miss: the potential for site-neutral payment reform to fundamentally change the healthcare landscape. By leveling the playing field, we can encourage more competition, drive down costs, and ensure that patients receive the care they need without the financial burden. But will our leaders take this bold step? Only time will tell. Connie Partoyan is the Executive Director of Better Solutions for Healthcare. What do you think? Should we prioritize site-neutral payment reform, or are there other solutions that could better address the issue of healthcare affordability? Let us know your thoughts in the comments.